So if a father has hypospadias, the chances that his son will have hypospadias is 13%. Hello, I'm Mrs. Kalpana Patel. I'm a consultant pediatric urologist in London and Surrey. Today I would like to discuss with you a condition in boys called hypospadias. Now, what exactly is hypospadias? Hypospadias is when the opening from where the boys pee is not in the right place. What do I mean by this? So if I can use my index finger to demonstrate, the top bit is the head of the penis, that is the neck, that's the body, and down below is the scrotum. So normally the pee opening is somewhere towards the tip on the undersurface of the penis. However, if it is further back nearer the neck or just a few millimeters below the neck, it is a mild form. From there till the middle of the body, it's a moderate form of hypospadias. Anywhere below that, up to the perineum, is a severe form of hypospadias. Now, why do we need to know these positions? It's important because the operation depends on the position of the opening. The further towards the tip, milder forms need a simpler operation. Now, how common is this? It is 1 in 150 boys born in general have hypospadias. Now, how do we know this is hypospadias? 1, the penis is of normal length. However, the foreskin is not completely around. The foreskin is only at the back and the sides like a hood. And in that hood, there are 2 areas of skin mounds or whorls. In severe cases, the penis may be bent downwards, called chordee or curvature. And associated with this, the scrotum may be abnormal as well. Normally the scrotum joins in the midline, but it may be separated, or the scrotum may go at the top, 11 o'clock and 2 o'clock position of the penis. There may be several associated syndromes. Not very common, but something to keep in mind. And also associated conditions like undescended testes and scrotal abnormalities that we just discussed. Now, in the severe form, the scrotal abnormalities may be up to 76%. Why do we need to correct this condition? You may say just leave it. However, boys need a straight penis to pee straight in front of them and for future sexual activities. So functionally, it is important, and in some cases, cosmetically, it is important as well. Before I venture into explaining everything, let me put a few facts in front of you. And those are the moderate and severe type of hypospadias may need corrective surgery more than the primary surgery. In the mild forms, the operation is just 1. And in severe hypospadias, the basic operations are 2. The first operation is you remove all the scar tissue from the undersurface of the penis and then put a graft from the foreskin. So remember, the foreskin is important in corrective surgery for hypospadias in severe forms. And please do not circumcise your baby after birth. It is important that we use the foreskin. The foreskin is put on the undersurface of the penis, and once the graft is taken after 6 months, you make a tube of the graft. This is very simplistically the corrective operation. Of course, you correct the curvature of the penis as well. After the operation, I use a soft catheter to take the urine away from the operation site, and also put a compression dressing to control the swelling. Now, at what age is the operation done? It's about 6 to 12 months. And does it affect potty training? No, it doesn't. Does it affect future sexual activity? Not if the hypospadias is corrected. And parents who wish their child to have a nearly normal looking penis, I can offer foreskin reconstruction in addition for the penis to look nearly normal. Now, some questions may arise in your mind, especially mom, did I do anything wrong during pregnancy? Clearly, you didn't do anything wrong. We do not know what's the underlying cause for hypospadias, but it is thought to be genetic and environmental. Now, the other question which may come to your mind is, can it be transferred to children? Yes, it can be. The chances that the future boys have hypospadias is higher than the general population. So if a father has hypospadias, the chances that his son will have hypospadias is 13%. And if a biological relative has it, then the chances that the boy will have hypospadias is 7%. Thank you.